The coronavirus pandemic has emphasized the importance of hand washing. Just when the world was trying to recover from the impact of the first wave of the coronavirus, the second wave hits again. Though it is said to be deadlier than its predecessor, a huge number of the populace in Nasarawa State are treating its presence with laxity. On the streets, people carry out their activities, unmindful of the severity of the second wave of the pandemic. Commercial motorcycle and tricycle operators alongside their passengers are on the move without any form of protection. Petty business owners too. The very few complying drop their face mask on their jaws. All of this is despite government's restrictions, even as some of them are aware of its existence.
People should know that it is real. I know there is a lot of controversy about COVID-19, but people should please be careful, and the government, I know all what the government said is for the good of the masses.
In recent weeks, the state is recording a spike in the number of confirmed cases, which has surpassed 1,000. The government is worried about the growing numbers and is extending sensitization campaigns to the hinterlands. Governor Abdullahi Sule meets with all district heads. He wants them to take the message of the new variant to their people.
I strongly believe that because of your closeness to the populace, you will do us a big favor by being the ones who will convey our concerns and the different areas of protocols and assist us on the awareness when it comes to the coronavirus pandemic.
There is less burden at the State Specialist Hospital Isolation Center, as many patients take to home care, except for few severe cases. Over 10 doctors here have also tested positive. The Chief Medical Director, however, insists preparation are in top gear.
We are ready for it. We've had the experience during the first wave, and this second wave is actually proving to be deadlier than the first wave in terms of the quantity of patients that come, and then even the severity of the ailment. But we're doing the best that we can.
While the people are placing wealth above health and the government is putting in place measures to stem the spread of the virus, it's an opportunity for others to make stipends. The sale of face masks resurfaces again, with the sellers mostly children, targeting no mask, no entry spots. Though aware of its necessity, they are not wearing one either. Although the government is stepping up efforts to contain the virus, if the people do not take responsibility, the spike may continue, as the safest bet for protection is adherence to safety protocols. Halima Gayam, Channels Television News.
Welcome back. Yes, indeed, it is January 18, the day that schools resume, even though there are different concerns in different parts of the country. So that is what we're starting off with today on the program. And as you may have seen in the welcoming slide, we're here in the studios. We've got Mrs. Olushola Gbadibo here with us. She is an educationist. Good morning, and thank you for coming on today.
Good morning, and thank you for having me.
And then joining us via Zoom, we've got Professor Innocent Uja, who is the president of Nigerian Medical Association and former Director General, Nigerian Institute of Medical Research in Lagos. He joins us from Benue State, as well as Honorable Awaji Nombek Abiante, a member of the House Committee on Basic Education. Good morning, gentlemen. Thank you for joining us as well today on the program.
Thank you very much. It's my pleasure.
Good morning, and thank you very much.
All right, let me start with here in the studio. As you may have, if you caught our opening sequence, the daily is reflecting concerns. Schools resume amid COVID-19 spike, and different sectors. I mean, some others say Nigeria is divided on the resumption today. Where do you stand on this matter?
Well, my thinking is that it's good for schools to reopen because whether the children are at home or they are in school, they still have parents and other people around them that go out. And whatever those people are coming in with is going to affect the children. But when the children are in school, we make sure that we put all safety protocols in place, like the washing of hands with soap, using of sanitizers, and social distancing, and all the other safety measures that we are supposed to put in place. So from the end of the school, I believe the children are safe.
So what about the concerns that people raise, that they think that quite a number of schools have not put in place this protocol, only a very minute percentage, and they predicate their concerns on that?
Well, I wouldn't want to agree with that in the sense that as school owner, you wouldn't want anything to happen to the children under your care. So you put in everything as much as the government has told us to put in place to make sure they are on ground so that in case of anyone, like when the children are coming in, the first thing that we do is we take their temperature, and intermittently we take their temperature to see that any child that is having high temperature is not allowed into the school. And before you even enter, you first of all wash your hand at the wash hand basin before you proceed to the class. And even during school hours, we make sure that we sanitize everywhere, and even the children. And they must come in with their face shield, everybody, including the teachers and other staff.
How do you maintain social distancing in the premises?
Well, we space the seats in the class, and we make sure that as at last term when we were in school, there was no assembly, and we made sure that the children were not using the playground. So they were like kind of restricted a bit from all the other normal school activities, except for the main education curricula.
So as far as you're concerned, your school have put in place this protocol and you should be in session?
Yes, I'll say that.
All right. Honorable Abiante, what say you on this matter?
Thank you very much for the opportunity. I actually feel the pains. I feel the pains of several Nigerians, including the position our mother, our sister, who just put forward her own take, that there is need for schools to reopen, giving assurances that they will do this, they will do that. Our concern has been that nobody substantially has done anything relative to providing the very basic necessities, basic means of adhering to the protocols as laid down by government, especially with the public institutions, the public schools. She has spoken from the perspective of the private schools, which ordinarily we know and believe have the capacity, have the commitment to make these facilities and ensure that the positions are taken and kept. I am talking about that pupil who will go to Yangoji school, that local government education authority school in Abuja. I'm talking about Abuja. I'm talking about that person who schools at one-man village. Not to talk of the peoples in communities like Agbakroma in my own constituency, who don't even have water. The community as a whole don't have water. They don't have a borehole. Not to talk of the luxury of having to provide it in the schools. Our position has been, yes, we are not saying schools should not reopen. Schools should reopen. But the fact remains that we have no data suggesting and submitting that majority of the schools have the capacity and the willingness to ensure that the protocols are kept. We are the same people who made interventions relative to students in exit classes, having in mind that there will be enough space, they can take all the classrooms that are available to enable them keep to the positions of and requirement of social distancing. But here you are asking everybody to resume. There are schools in this country where the pupils learn under trees, up till now that I speak with you. The challenge of accommodation is very huge in these schools. What has government done between the time that this COVID came, the first phase, the first wave, and now? What have they done? Nothing, absolutely nothing. the level of preparedness of this government, this very government, in keeping to the things that they have laid out is very, very appalling.
If you could just clarify some of your submissions. But when you say you have no data to rely on to show that certain people have complied, so upon what then, how did you come to the decision that schools should not reopen if you have no data?
I didn't say that there are no data that we use. We are in sync.
That's what I heard you say.
We are in sync with the UBE. And from what they have not, those things have not been made available to everybody. So on what premise is the government relying to open the school? Don't forget that it is the same government that came to us to say, no, we think we cannot reopen on the 18th. What additional information did they get? Because the available data at the time they say schools cannot reopen on the 18th suggests that the very basics have not been met, have not been kept. But what additional data have they provided? That is my question. I didn't say there's no data at all. What additional data did they have that countered their position that they cannot reopen on the 18th? Don't forget that the same federal government told us at the press briefing, school will reopen on the 18th. They came back and said, no, school will not reopen on the 18th. We have to reevaluate. After re-evaluating that position, what have they put forward to us? Nothing.
If you could shed a little more light on this, because just as you equally highlighted that the private schools, you say they have the capacity to go ahead and comply with these protocols, but you are concerned about the public schools. So, because that means that the decision you're taking now, or the House is suggesting now, will equally affect the private schools. So, could you just tell us, what did the House or the committee rely on to come up with that suggestion that several schools have not complied, or a minute percentage has complied?
Thank you very much. The House is made up of members from different backgrounds, different constituencies, with different challenges. We had our meeting online, and members were asked to make submissions based on their findings. Don't forget that we're on holidays. I am not in Abuja, meaning that I am somewhere within my constituency. I have looked at what is available here, and they have not conformed substantially with the requirements. The same with members from several other areas. And we are saying, we're not against school reopening. We didn't say school shouldn't reopen. We said, give 3 months, and government should be serious with providing the very basic requirements. One of the requirements is that there should be a central entry and exit point. How many of the primary schools in my village, how many of the primary schools, even in your own village, are fenced? How many of the primary schools in Karan and Moda are fenced? These are some of the challenges. It is also required that they will have a means of keeping to the WASH standard, water, sanitation, and hygiene. There are no boreholes. These three months window will afford and can afford a serious government to make interventions in these areas. These are the things that we are saying. How many of us, even on the streets, not as students, adhere to the protocols of wearing masks? You take the census. How many, you showed us something that's happening in Nasarawa State. How many Nigerians did you find in Nasarawa wearing masks? Talk less of those that are going to be in school. Those who...
Just hang on a minute, Honorable. We'll come back to that. Let's get Professor Uja to equally comment on this matter. Prof, you're a medical professional. What is going through your mind now?
Well, thank you very much, my friend. It's unfortunate that we have to be going round and round. The Nigerian Medical Association had made this statement before. Now, what I probably will say and start with is that what lessons have we learned 1 year after? If we know that students should go to school, and they should go to school, what facilities are we put in place? Our problem is that we do a lot of talking and doing very little. It's also true that we do not listen to experts. Now, what we have been saying is that this coronavirus pandemic is totally unprepared for. And that had been since it started. And 1 year after, what lessons have we learned? We know that students will go to school. We know that they should maintain the NCDC protocol. But what have we done in the schools? You see, Nigeria is a very, very interesting country, a country full of contradictions. At one point, we should do social distancing, we should follow the protocol. At the other point, where we are going to be ready. At the other point, we are ready. Whether it is private, whether it is public, injury to one is an injury to all. The truth is that we have no statistics, as far as I know, of the number of schools that are ready, whether public or private, and what they should put in place. I think that we are very sentimental as a nation. Let's follow the advice of experts. While we are saying that schools could reopen, we should be prepared, and there should be monitored. Who are those monitoring? Who are those supervising the process? Because we talk and we don't supervise. In Nigeria, unless you push, nobody works.
Prof,
and I don't believe
just
that.
As you said, my apologies. Just as you said, you've put out this statement over and over again that you do not think it's right for schools to resume now. But one wonders what your recommendation would be, given that from what the Federal Ministry of Education is saying, they had consultations with state governors, with commissioners of education, with proprietors and heads of schools, staff unions, even students. And that's the data, perhaps, upon which they said it's time for us to resume school. So what would be your own recommendation against this?
Let me just tell you that sometimes we work from the answer. You see, the truth is that when we say parents, where we say they do not, even those who are not in school, they are not obeying just like the honorable member of the House said. Those of us on the streets, how much of compliance to the NCDC protocol? We are not complying. We say this. The Nigerian Medical Association have been singing that we need to comply. Now, suddenly, everybody says people should go to school. What evidence have they had? If the Minister of Education says so, who are the supervisors? Where do they go to monitor or to supervise the process? To say, well, what you have said, you are correct because we have evidence to show that this number of schools have complied. It's not just sit on the round table and say that we want the school to be reopened, there should be no problem. You see, we have suffered this because people do not listen to experts. The Nigerian Medical Association, from the beginning, cautioned on all grounds the process of entry, how we should stop people from coming in. We talked about social distancing. We talked everything that we need to do to present scientifically we have done. But we have no power of enforcement. We cannot enforce anything. Our own is to advocate and bring out the scientific component, not political or the sentimental component of this pandemic. And that's why we face what we are facing today. Look at today. We are overwhelmed with the second wave. There's no oxygen. Patients are overwhelmed. The hospitals are overwhelmed. Why should we wait until we are overwhelmed before we will act? We need to be, that is what we call emergency preparedness and response. We need to prepare. Planning is very important. And I think in the area of planning, we have not been doing very well. And the national response, okay, you see, even the non-pharmaceutical component of the response is not being complied with. A lot of people still are going all over the place without bothering. So we are saying that if the school should reopen, which we say they should, we must be prepared. Prepared in that I don't see how we can control the students. I don't see that.
All right, Prof, let's bring that in back to the educationist in the studio. Maybe she has some answers for us. That component is also a concern for the UNICEF. Children don't mind, distance learning, virtual learning, but that element of playing with their friends, of learning together in a class, controlling that is going to be really difficult, don't you think?
Well, the thing is, with the virtual learning, it may not be so easy for some group of parents. But when the children are in the school, they don't mix at all. But the thing is, we try and educate them and make sure that they don't hug or they don't do things that will cause them to kind of mix together in such a way that if there's any, and we are even sure that there can't be anybody, because before they come in, we have taken their temperature, and we have taken all that we need to know about them.
Is there a plan to conduct COVID-19 tests for students in school?
No.
Because it's part of the recommendation of the Federal Ministry of Education under the school readiness template for school at the school level, that parents are supposed to submit the field COVID-19 consent form for testing.
Well, not on ground yet. Presently, we are not having such plans. All we do is take all the necessary protocols.
But did the schools agree to some of this? Because if they came up with that notice, it means that that is what everybody has agreed to.
Not to my knowledge. Even from the National Association, that's of proprietaries, I don't think there's anything agreed to in such manner.
So is the National Association on the same page that schools can go ahead and resume?
Sure.
So what about the concerns they raise about the public schools? Because, I mean, yes, private, they say may be ready, but they have concerns about the private sector.
Well, the public schools, I think the government should have made provisions, but I can speak for Lagos State. Like in Lagos State, they make sure that they provide all the necessary things like washing of hands, providing a temperature for the gauge for them to take their temperature and things like that. So I can speak for Lagos State.
Do you think it's a good idea for government to conduct COVID-19 tests for the students? You remember that in October, we mentioned it earlier today, 181 students in one school tested positive for COVID-19. And that, of course, is because they tested. Do you think it's a good thing that the government should also make that something that schools should do?
Well, if the government can do it, it will be a good thing. Because the government is asking people, the public schools now to come in. But the private schools are taking precautions. But the public schools are not doing anything. I'm not talking of Lagos State, but most other states, they are not doing anything. So if the government can conduct COVID-19 states and test for the children, it will be a good thing.
Professor Uja, do you think would it comfort you if students were to take COVID-19 tests in schools just to ascertain their state?
That would have been the ideal thing, but it will not happen. It will not happen because even some states do not believe that they have COVID in their state. You see, the truth is that, let me just say this, Chamberlain. If you ask the private schools that the parents, the children should stay at home, but they should pay school fees to the schools, they will tell you, okay, that is good. So what we are looking at is not necessarily the interest of the students. It is the fact that you know that many of the schools were down during the lockdown, where schools were not reopening because the schools are not getting money to even pay the teachers. And that is one area that we must look at. It is not because they want, I'm not saying that it's the totality of all schools, but the monetary component is what appears in my mind to be supreme to the private schools. First of all, and secondly, the public schools, I don't think that they can cope. And you see, a human being is a human being, whether public or private. The only thing that separates both of them is poverty and riches. So in Nigeria, we are all equal before God. And I believe that there's no need to segregate. In this case, if we are not ready to comply with the protocol, there's no need for the student to go to school. You have to be alive to be in school. And there's no age determinants in terms of going to school. Anybody, you recall that there have been somebody who about 70 or 60 years that went to primary school or secondary school. No, now why we are saying that we should be more serious. If we are ready and prepared with the protocol and comply with the protocol, which you and I know that is not true, then the schools can reopen. Now, when we say that schools should not reopen last year, everybody said the school reopened. Some parents were even making derogatory statements about the NMA. That you can see that there's no professionalism, because if the professional will say, look, these are the dangers, these are the risks, and somebody who has no modicum of idea as to why these things come about, then be saying all sorts of things, then you know that we are not there yet. And that is where we have these problems. The reality is that many of the schools, including some of the private schools and many of the private, maybe Lagos, but outside Lagos and probably Abuja, it is difficult to say how many of the private schools are ready. And Lagos is not Nigeria. Lagos is just one of the 36 states and FCT of this country. So we cannot extrapolate what's happening in Lagos totally. Even in Lagos, there are some places in Ajegule and Elimosho that do not have the capacity. So let's not just extrapolate Lagos to Nigeria. We are all human beings. The problem is poverty and riches, and we should not segregate. So if we are not ready, we are not ready. It doesn't matter what anybody feels. And as experts, we are to give our advice and caution about the pandemic. We have not been able to contain this. If anything is now geometrically increasing, and you can see the statistics that we have, which we think is probably 1/3 of the reality of what is happening on ground. On ground. Now, what about oxygen? How many schools have oxygen to even give emergency preparedness? How many schools have a clinic that if a child has fever? How many, if you go and find out, that's why I say with the Federal Ministry of Education should monitor how many of these schools have thermometers. We are very quick to make a statement or to feel that if it's our children today, will say no. But because I believe that if the school reopens, my child will stay at home. Because the reality that I cannot manufacture a child.
Remember, Prof, you equally did say that we don't have data for some of these things. So when we ask those questions as to how many schools have done this and that, it may sound rhetorical because we don't have the answer to that.
Chamberlain, you have casual data that we have. If you go to the street, I've been on the street, I've gone to the marketplace, I've gone to the bank, and all you need to do is just to stand and observe how many people that have this. You don't need to go and do a statistics of everybody.
All right, but you extrapolated now, Prof, didn't you? You extrapolated from what you saw in the banks, and then you now say, everybody is not ready.
Even in Lagos that we are talking about, we were talking about in Lagos, go to Ajegule and Alimosho and see whether people, even the central Lagos area. You see,
all right, so we'll come back to this in a moment, Prof. Pardon me, but just hang on a minute. We'll be back in just a moment. Stay with us.
One in every 5 of the world's out-of-school children is in Nigeria. Even though primary education is officially free and compulsory, about 10.5 million of children aged 5 to 14 years are not in school. These statistics is from the United Nations International Children's Emergency Fund, UNICEF. The situation is even worse in the north as a result of the effect of insurgency and other economic barriers and socio-cultural norms, including practices that discourage attendance in formal education, especially for girls. States like Kano are trying to bridge this gap, and that is why it's brought together parents, traditional rulers, and community leaders to deliberate on how best to develop education, especially in rural communities.
Education is no longer the business of government alone.
The majority leader of the House of Representatives identifies what is required to improve the standard of education.
Every important person in the society is also expected to play his own bit in the development of the educational sector. We are all beneficiaries of the educational development of our own communities. Without education, we would have not come to this level. Without education, our children as well would not have come to this level.
While traditional rulers appreciate the support of government and various individuals, they advocate the need for more assistance in order to ensure that all children are educated, especially as education is free and compulsory in Kano State.
It is encouragement to the pupils to give their contribution toward the development of education in all parts and sectors of the local of the education. So we pray to Allah to continue guiding us and give us courage to give our support and contributions toward the development of the education in our state.
As the drive to improve the standard of education in the state continues, The State Senior Secondary Schools Management Board presented a word of appreciation to some individuals for their support and contribution to the state free and compulsory education program. Idris Jubrin, Channels Television News.
Welcome back. We're taking a look at the perspectives concerning school resumption. Today, the House thinks otherwise. They shouldn't go ahead and resume, but Mrs. Gbadebo telling us that they have put in place those COVID-19 protocol and they are good to go. But let me get back to you, Honorable Abiante. When you say the House had this meeting online, you asked questions about how many states or schools are complying, and the feedback was not good enough. But what is being done, or what recommendations was there or was given about doing something about the economies of these schools? Because in several other states, several businesses, they've resumed, several things have gone back to at least doing business, doing a thing or two. But for these schools too, are we glossing over the fact that, look, something needs to be done? Because I do remember the emergency stimulus package, which was passed by the House. I'm not sure what happened in the National Assembly. There are still questions as to how many were even attended to, because the economies of these areas have got to be considered. Did you factor that in?
Yeah, thank you very much for that concern. Before I clear that, I would also want to get back to some of the issues that have been raised as a result of these discussions. The educationists mentioned the fact that they take temperature of students. I want to state that taking temperatures alone should not be enough. It won't be a very clear indicator if somebody is infected with COVID-19 or not. And when you talk about testing, what is the interval of the testing? Is the testing going to be done every day? Is it going to be done every 2 days? You can conduct a test on Monday, and by Wednesday, Thursday, Friday, somebody is infected and he would get back to school and contaminate several others. We have stated one fact here, and the fact is that we seem not to have clear-cut data on what is happening. And it's unfortunate, very unfortunate, because almost every agency, department, or ministries in government have departments saddled with the responsibility of planning, doing research, and at the end of the day, they will come out with data they call statistics. We also have a National Bureau of Statistics. Since this thing started, what has been their input? What have they been doing? What have they done? Nobody should have been talking about, oh, we don't have the data, we don't have the knowledge. Maybe if they have, it's not public. If everybody concerned has really done their job. Back to the clip that you showed us about Kano State, where they were making, having discussions on how to move education sector forward, and probably they must have discussed issues about how to resume school. You could find out that several of the people seated there never had their nose mask or their face mask on. They never had it. So what are they telling us? What is the implication to the larger society? It simply means that we may not be ready. And back to our submissions, we had said, if the government is serious, take 3 months and get to remedy the much that can be remedied to ensure that schools have gotten to the point where they can conveniently and comfortably reopen.
Well,
there have been interventions in
just one moment, just perhaps to get some perspective on some of the things that you have raised. You know, the question there that comes to my mind is, of all the conversations that you have heard, are you saying that there was no conversation with the PTF COVID-19 at all? No conversation with the Ministry of Federal Ministry of Health to say whether or not we are ready? Because your committee is one of several in the House of Representatives, and there is a House Committee on Health. I would assume that some of these things they are already also being carried out. So, are you saying there was no conversation with any agency of government to verify, to speak with you about this matter?
Thank you very much for that observation. In fact, Professor Uja has stated it clearly as it should be said, that in Nigeria, we do more of talking. We talk, oh, we have done this when it has not been done. We are doing this when we don't even have the intention or the intent of doing them. We sat with the relevant agencies and ministries of government and developed a template alongside the Ministry of Education, things that will be required, things that will be necessary. We had our input. These are the things that we expect should be done for schools to conveniently and comfortably reopen without having the fears, without having to have the anxiety of what happens to our children. How much of it has been implemented? That is our concern. Our finding is that the whole thing is on paper. It's just the paper. I have a copy here. It's just paper. Nobody has consciously and conscientiously done anything to ensure that these things are put in place. We are not just saying it today that schools will require to have enough classrooms. No, we are not just saying it today that schools will require to have wash facilities. No, we have said this long ago.
Okay, Honorable,
even before the students wrote.
What was in that recommendation?
Been implemented.
Just a minute. In that recommendation, could you talk to us about what was said about students in public schools and them going to school via public transport? What did you say? What was the recommendation on that?
If you must take students via public transport,
okay,
are the facilities even available?
No. My question is, Honorable, on that recommendation, just a minute, on that recommendation, what was this? Could you read it to us? Because you say it's already there.
Government is encouraged to provide facilities to transport students to their various schools to and fro. That is the recommendation. Government is encouraged. That is for the public schools. The private schools have their own arrangements. They do. They have their arrangements. And if you don't keep to the template that have been laid out for schools to reopen, what exactly do we want to do? What exactly are we saying we want to do? We want to reopen schools when the very basic things that we are supposed to put in place have not been put in place. That is our. We are not saying schools should not reopen. No, schools should reopen. But we are saying, can the government?
When you say government is encouraged, that's neither here nor there. Because I mean, we have had different states tell you, look, that is if you mandated them deliberately. Because even today, it's so difficult for a lot of them to do that. But you didn't speak to the question as to what is being done about the economies of those schools. Are you just saying don't open until all these things are done, because it appears as though they can't fulfill all those requirements?
Good. I was actually coming to that. There have been several interventions in the areas of agriculture, even in the areas of health. There have been interventions. We also expect that there should be interventions to save
for the schools, not the country.
There should be interventions to save the educational sector in this country. This is the future of Nigeria.
No. What was the House's recommendation for the economies of those schools if you say they should not open? Because remember, several teachers did come up asking for help because many of them have not been paid.
The House explicitly recommended that government should give support to schools, especially the privately owned schools, because the government institutions, government schools, the teachers still draw salaries. The area of the greater challenge were the private schools, that government should give support to the schools. That was the recommendation of the Committee on Basic Education.
Did the Senate concur with that recommendation?
I will not be able to say yes or no here because I can't really record that.
No, Honorable, but you're a member of the National Assembly. This is pretty straightforward.
I am a member of the National Assembly. I think the House of Reps, Chamberlain, the House of Reps, where I'm a member, we made that recommendation, and we sat with the Ministry of Education. Sitting with the Ministry of Education meant that there had been that understanding between both chambers. And part of the commission that was forwarded to the Ministry of Education was to give support. They should give support to the private schools. The public schools still take their salaries. So they are not the major issues here. The major issue that those in the private sector who cannot get their salaries because schools have not opened.
So could you tell us then, what happened to the stimulus bill, the first and the second one? Did the National Assembly pass it? Can you hear me? Okay, well, Mark, let's get to Mark. I think she's got some questions as well. Mark.
Indeed, I mean, now the date has not been shifted. Some people will say, you know, what exactly is the point of this conversation? Because today is D-Day. Some children will be going back to school today. What exactly should we be expecting now that, you know, the schools are reopening anyway? What advice will, say, Professor Innocent Uja give to students or parents who are going to be letting their students or their children go back to school today? For the schools that are reopening, what precautions would he say they must adhere to, for instance, to ensure that students are safe while they're in school? Prof, this is for you.
Well, thank you very much, Mark. First of all, what should we be expecting? We expect that many more children will get infected. That is our prediction. The second is that we've been talking about maintaining or complying with the NCDC protocol of regular hand washing, use of sanitizers, use of face mask, and social distancing. Those components have failed because even parents were not using it, not to talk about children. You all know that children's immunity is lower than that of the adults, and therefore the risk of contracting COVID-19 is far, far more among children than adults. So we've said it, and we say this over and over again. What else can we say? It is probably just for us to be singing now, because Nigerian Medical Association has done all that it needs to do. We talked to the policymakers, we've talked to legislators, we've talked to parents, we've talked to... So what else do we do? We have no power of enforcement. We cannot enforce anything. All we are doing is to give professional advice and also say that we should be very cautious. But it depends on who wants, even the belief system. You saw that they will say, hey, doctors have come again. But when it really downs on us,
sorry to interrupt you, Prof.
Say that, yes.
The question is this. I mean, so far we have seen, and I don't know if this is scientific, but so far we have seen that this virus hasn't affected children as much as it has affected the elderly. Indeed, the immunity of children are not as developed as that of adults, but for some reason it has been shown and proven that children have not been affected with the virus as much as an older demographic, for instance. So what danger, given the experience that we've had in the first wave and also our experience over the holidays, and even right now with the statistics that we have, we've had, if at all, we have had no child dying as a result of this particular ailment. Is it really expedient for us to say, look, until all of these safety protocols are put in place, no child should go to school?
So are we saying that children should start dying before we prevent? What we are doing is prevention. We want to prevent, not to see them dying before we say children are infected. You will know that the risks, the exposure, first of all, we need to expose a large number of people. At the moment, the exposure is more of the adult, and because many of the children are indoors and are kept in the house, the parents go out And that is the exposure. Now, the truth of the matter is that it is what you see that you know. Many of these people that probably are infected, we don't have the records. We are saying that probably we do not suffer the same as happens in Europe and America. But the truth is that we don't have a very reliable statistics. There are so many people that are dying.
Even in Europe and America,
don't go to
sorry
facility.
to interrupt you again, but even in America, where the statistics are available and where, you know, increasingly we see visuals and things of the sort, we haven't, I mean, nobody wants any child to die, certainly not. But what we're saying is, from evidence available, have we been able to show that this virus affects children adversely? And I think that's the key word there. Yes, one can be infected, but the question is, do you fall ill as a result of it? After all, we've heard of adults who are completely asymptomatic even though they've been infected. I think the concern, and what has raised a lot of concerns for people and why this has been declared a global pandemic, is the fact that people are dying from it. But if our children, and for some reason children are completely protected from the adverse effects of the virus, what precisely are we protecting them from?
Actually, I don't think you've gotten it right. If it is the number of deaths, then we shouldn't bother ourselves. Because unlike Ebola, that will kill about 98%, COVID-19 will kill between 3 to 4% of the population. So it means that we don't need to bother. Health is not about dying. Health is about the state of physical, mental, and social well-being of an individual. And we should take it that way. We should be prepared. And as professionals, we will continue to caution people, we will continue to advise. It's not when people are down, then you say, well, unless you want us to experiment. And at this stage, we should not experiment. Otherwise, we expose many of the children to the disease, to the virus, and see how many of them will come down. That is a research study. I don't think any child, any parent would want his or her daughter or son to be exposed to say whether many more children are dying or not. Statistics is not the issue. These are human beings. In a family, if one person dies, that's 100% for that family. So what we are saying is that we need to prevent. That is what we call emergency preparedness and response. We need to respond, need to prevent, and prevention is better than cure. So I don't think it is correct. We're not saying that children should not go to school. We are saying that we must be prepared to ensure that they don't contract the disease. And by doing that, we are saying that people should obey the protocol, the NCDC protocol. And all we need to do, give ourselves 2, 3, 4 weeks and monitor what's happening in the schools. It will be the first 2 weeks, that people will comply, even those who will comply. After that, they throw all this advice to the winds. So I'm saying that we don't have to wait. We don't have to experiment on people, expose children to the virus before we know that they are going to be infected.
Well, Prof, the way you put it, it's not that these schools, just a minute, not that they're exposing the children deliberately to all of this, is because, as you heard, they put in place certain measures. So they didn't completely ignore all of those protocols, as it were. But you are saying that if schools open, your child will not go to school. For how long will this be? Because, experts have said it time and again that, look, this virus will be here with us for a while. We'll have to adjust and put things in place to live with it.
Yes. What I'm saying is that as long as the schools are not prepared, because you see, let's not take one aspect of the story. We say they should be prepared, and the essence is that the schools must be prepared. You see, it is going to be very expensive, and I'm happy that the member of the House, honorable member of the House, said this. There should be some level of intervention. There should be a level of palliative to the schools. It is terrible. It is not easy. And therefore, we have to balance the economy.
Okay, because
people are going to school.
All right, Prof. We're winding down now, so we'll just need to see how we can make it quick for everyone. Pardon me. Honorable, when they talk about, if you say your constituency doesn't have some things, no provision of water, borehole, and none would have thought, isn't that part of why you were there in the first place, to ensure that all of these facilities are in place for your constituency, which is in Rivers State, I stand corrected? But then, what Mrs. Gbadebo here did equally say in her opening was that if you say schools shouldn't open, it does appear as though we may not be considering all of these factors together because the markets are open. Several other places are open. So parents will go out and come home and meet the world and things like that. So when you say schools don't open, are we looking at it holistically?
Thank you very much. We are making our efforts as much as we can. If everybody were born the same day, probably you will say you solve all the problems in one day. We are making interventions and getting the attention of government. And that is why you see sometimes my people get so worried, they get so agitated. Because things that ordinarily should have been solved 50, 20, 80 years ago have remained unsolved, even despite the fact that we are contributing so much towards the purse of the government. Even if you devote all the resources that you have today to the provision of one single infrastructure, water, you may not be able to get it run everywhere. And don't forget also that our environment is so challenged that the way, means, and the resource you use to get water somewhere else, you cannot have that in.
Essentially, it would seem like what you're saying.
Coming from. So we have government to assist us the more.
Okay, it would seem like what you're saying is that we cannot meet all of these challenges. But if we can't meet all of these challenges, then are we saying that we should just everything should remain shut down? But we're running out of time. Let me take this on with you, Mrs. Gbadebo. Benjamin sends a tweet and mentioned us. Says, my child tested positive in a school last year, despite all the things the school assured us that they have in place, like your guest is claiming now. That is you. He did not have high temperature, so school's thermometer did not identify anything. Well, we can't tell whether it's a private school or a public school, but the symptoms will definitely be the same. How do you react to this?
The thing is, like I said earlier, we take our precautions. And another thing is, any child that you notice is having any symptoms, maybe like coughing, like having some health issues, we quickly isolate that child.
The challenge here, Mrs. Gbadebo, is COVID-19 is such that there will be no symptom at all, none at all, even when someone is positive.
I know that. But the thing is, everybody should take responsibility, even from the home. If, as a parent, you are taking responsibility of making sure that you wash your hands regularly and you educate your children regularly. If I do it, if you do it, if everybody does it, and the National Orientation Agency, if they do their own duty of educating Nigerians, then it will go a long way in limiting the spread of this COVID-19.
All right, then, Mrs. Olushola Gbadebo, an educationist. We've also had Honorable Awaji Inombek Abiante, member of the House Committee on Basic Education, representing Owan Federal Constituency in Edo State, actually. And then we have Professor Innocent Uja, President, Nigerian Medical Association, and former Director General of Nigerian Institute for Medical Research. Thank you all for joining us today.
Thank you.